Hello and welcome to today's episode of Healing and Growing Hand in Hand podcast. My guest today is Gabriela Rosa, and I'll give you a little bit of background on her and then we'll get into a great conversation. So she is a Harvard University Award scholar. She is a fertility specialist, and that's a lot of what we're going to be talking about today. And she's a best-selling author, and her latest book is Fertility Breakthrough: Overcoming Infertility and Recurrent Miscarriages When Other Treatments Have Failed. It's going to be really good. And then you're also an entrepreneur since 2001.
Yes, absolutely.
Yes. So our topic today, which I love, I just, when we had our conversation about the podcast, I was just so encouraged and never heard this part of how trauma can affect fertility and cause infertility. So it's how to transmute trauma to overcome infertility and recurrent miscarriages, even when other treatments have failed.
Absolutely.
So
Such
tell
an
me,
important conversation. Yeah.
yes, it's huge. And I actually know people who have struggled with infertility, and I thought back and I thought there's a few of them I know that have had trauma in their past and wish I would have known this. So tell us about yourself and more about this.
Yeah, absolutely. So, I mean, I think you've described all of the things. I have been helping couples overcome infertility and miscarriage for a long time, since 2001. And, with my team, we have now educated and helped over 140,000 people in more than 110 countries. So, it's been a wonderful journey on many, many levels. And as you can imagine, as a clinician supporting couples in this way, we are privy to many conversations that most people wouldn't talk about, at a dinner party conversation.
Yes,
right.
yes.
And even the fact that infertility and miscarriage to this day is still so taboo. So many people feel like they can't really share, and there's a lot of shame and a lot of vulnerable stories, around this topic. It's not everybody. I mean, for every person that you hear talk about their stories, there are so many that feel really confronted, by what it is that they're going through. 1 in 6 couples is infertile or experience some kind of reproductive challenge, right? Wow. And, it's every single person, even if they might think, oh, I don't know anyone, every single person knows someone who has experienced, a reproductive challenge of some kind. And when it comes to miscarriage, it's even more pronounced. It's almost like 3 out of 4 pregnancies actually in the early stages end in miscarriage. So, sometimes we dismiss or not consider a woman who has just seen a positive pregnancy test and then all of a sudden saw a negative pregnancy test, a few days afterwards. But all of those instances, certainly, as they accumulate, they in themselves can cause trauma, but there is definitely a lot of evidence these days to show that, childhood traumas and other sorts of trauma, sexual assault, all sorts of things can lead to challenges in terms of reproduction. And so, it's a very important conversation, I think, for a lot of people who may be struggling.
Right. Yeah. I remember when, we were trying for, when I was married and we were trying for our son, we went to the doctor and, got a checkup and everything. And I just remember him saying, and I don't remember what the statistic was, but just how difficult it actually is to get pregnant and then take that baby to term, a live birth. I was shocked for a human being.
Absolutely. It's interesting because a lot of people don't actually realize that, the thing about it is this: in the general population, the great majority of people conceive without trying. Okay. So that's why we have this conversation of, quote unquote, overpopulation and, all sorts of discussions around that topic, because we think that, okay, well, everybody's getting pregnant, like it's the old story of like, oops, I'm pregnant accidentally. And, the reality is that, I don't even know how humans continue to exist and continue to reproduce, because in any given cycle, a woman has a 20% chance of getting pregnant and taking home a baby in basically, in peak fertility. So imagine, it's not very much, and that is in her early 20s. right?
And she's healthy and there's no problems, right? In a perfect world.
Absolutely.
Wow.
So, we're talking peak fertility, 20% chance. As we, become older and as time progresses, that percentage decreases over time. But also there are obstacles that might come into the equation that decrease those odds to begin with. So for example, a woman might be diagnosed with irregular cycles. Right. For whatever reason, or a man might have lower than the average amount of sperm, or the sperm is not as good quality as it could be, or you name it. There are many different types of situations that could occur that come to the fore when a couple's trying and has been trying for a while and they don't really understand what's going on. The chance of conception, and by the way, at peak fertility, at that 20% chance, the majority of couples will conceive within 3 attempts. That's 3 months. Okay. Right. So it's pretty good odds, really, Yeah. However, as we add one of those situations that I was talking about, all of a sudden we go from an average of 20% and 3 months time to pregnancy to an average of 2 years. Time to pregnancy. So it's a dramatic increase in the amount of time to pregnancy. A second minor factor or a second obstacle takes us to an average of 7 years, and a third takes us to an average of 40 years. Now, nobody has 40 years to get pregnant, right? And this is based on epidemiological research, population studies around the globe. So, it's large data. The interesting thing about it is that and if we just did some rough calculations and we're very conservative on numbers, we've got a situation where, say, almost 8 billion people around the world, if we remove all of the elderly, if we remove all of the children, if we leave people who, kind of are in relationships, or just of the reproductive age, say between 45 and 42, 43, we are left with approximately, and again, being conservative, so the numbers aren't exactly correct, but about 100 million people who experience some kind of reproductive difficulty. So you can imagine, there are pros and cons to this kind of statistic, right? When it comes to public health, and that's my background, I've got a master's of public health from Harvard, and I'm doing a doctorate of public health there. And, public health's mandate is really, how do we support and do the best that we can for the largest number of people, but doing the absolute minimum that we can. Right. So basically, how can we do the least for the most number of people? Right. It is really kind of, because you can imagine when we're dealing with 8 billion people around the globe, we're really having to look at resources and figure out, okay, where are resources best utilized? Right. In terms of public health. Right. So those resources, and if you have a look at, different organizations around the world, those resources don't go to patients who are experiencing infertility because the majority of the population conceives without trying. Right. Right. So we then end up with this situation where couples who are struggling become underserved on their journey. Okay. And when they are not underserved, what happens is that they are guided towards, strategies, treatments, and so on that are self-sustaining. Okay. So that basically can pay for themselves or make a profit. Yeah. So that's typically how the healthcare system is oriented. Yes. Okay. That's typically how it's structured. So that, if they're going to conceive, they're going to conceive, and let's just be as hands off as we can. And if they're not going to conceive, then, well, we might give some assistance, but otherwise let them just pay for whatever assistance they want or need. And good luck with that. It's kind of like really what happens. And, it's what happens around healthcare systems around the globe. We treat patients in every continent other than Antarctica at this point. Right. And I see that kind of similar narrative in most healthcare systems. Right. There are some healthcare systems that are slightly different because they have different, kind of objectives. But for the majority, really, it's looking at how can we do the absolute least for the most number of people. Right. Now, when it comes to the types of patients that we're discussing right now, which typically there are many, many layers to, why they are struggling to begin with. It's not as straightforward as going, oh, okay, here we go. We have no ovaries, or we have no testicles, or we have an absolute genetic mutation that precludes this person from being able to reproduce. Really, only 5% of the global population has a genetic problem that will stop them from reproducing. So
it's actually kind of encouraging.
Well, but precisely. So typically it's not that, typically that's not the reason as to why people don't actually conceive and take, healthy pregnancies to term.
Right.
There's multiple other factors. And as we saw, if we add just these minor factors, these little obstacles, that the impact of them can be so powerful and extremely substantial. And to the point that, it can make the difference between having a baby and not. Okay. And so that's why, from the perspective of how do we address these situations, we really do need to take a step back and go, okay, if we were to look at self-care, if we were to look at what are some of the other factors that we need to take into consideration, what could they be? And there are many of them. And, despite the fact that, when a couple typically goes to a doctor to ask those questions, what else can I do? They're usually faced with, look, there's nothing you can do. You just need to go to IVF, or you just need to go and do this other thing. And that's where, there are lots of challenges in different paradigms, because that's not necessarily the case. That's not necessarily true. The impact of even our thoughts on our biochemistry and our body, how our body responds to things can be enough to change the way in which that communication between the different places within the body. So the hypothalamus and the pituitary and the ovarian axis, for example, can become completely shut down in trauma, right? And so what happens is that it's not simply a matter of going and doing fertility treatment, because in many cases where those concerns or issues aren't addressed and uncovered, they continue to perpetuate the result that a couple, may not want, which might be infertility or miscarriage. Right. So there's a lot in there to unpack, it's there's so many things. And, what's interesting as well, and I think that this is something that there are many books that have been written about this, but one of the ones that I love is called The Body Keeps the Score. And so if people Google that book, when it comes to trauma and when it comes to looking at how trauma impacts health, it's a fantastic book. It's by a researcher at Boston University, actually, who has done a great job at really outlining some of these correlations, some of these pathways in which this occurs. But what's fascinating about it is that when it comes to trauma, although there are many ways of addressing trauma, one of the biggest obstacles that people face is that inability to really have almost the internal strength, because of trauma itself, to really engage in the process of addressing it. I mean, your background, I don't have to tell you this, but sometimes people listening, it's very, very difficult when we're confronted with something that we don't know how to address or how we might be able to overcome it, to want to ignore it or to want to look the other way. Right? Because it's like, oh my God, this is way too scary. And if I go there, then what if I can't get out? Or what if I get all consumed? What if I'm overwhelmed? And that in itself is kind of like a process of, becoming flustered that we don't know if we can get out of. Right. And so we often will reject even the possibility of doing those very things, because it's like, oh, whether it's the sexual abuse or, some other kind of trauma, it just becomes way too overwhelming to really look at.
I've also seen where people downplay it. Or dismiss it. Oh, it wasn't that bad. It wasn't a big deal.
Absolutely. And isn't it interesting how the brain will do anything to delete, distort, and generalize so that we can feel safe, right? Because that's the whole thing. It's like where the body's really just, the body and mind are really trying to do a really great job at going,
Right.
okay, how can we make you feel safe in this situation? And so we will tell
Right.
ourselves all sorts of things,
Yes.
right, to be able to get through the day, really,
Right.
in a lot of
or the moment
situations.
sometimes,
Or
even
the
just the
moment,
moment.
absolutely,
Right?
absolutely, 100%.
So I have a question that came up, and what is the difference, or I mean, if you can explain, like, is a lot of the work you do just for the women? Men have trauma too, right? So what do you see
Absolutely.
with men as opposed to what you see with women?
Yeah, no, look, I think that's a fantastic question. And, I have this little saying that I tell my patients all the time. Fertility is a team sport, right?
Like
It
that.
really,
Yeah,
it
that's
really,
true.
absolutely. It really is not a situation where if a couple is struggling, like I often talk about this analogy. Every system is specifically designed to deliver the outcome that it's delivering. Okay.
Right.
So, and the system in this situation is comprised of two major parts, the female and the male, right? That individuality that then comprises the couple, right? And it is the couple that's trying to get pregnant and take home a healthy baby.
Correct.
It's not the woman, right?
Correct.
And it's not the man,
Right.
it's the couple. And so from that perspective, we need to really look at it and go, okay, given that that's the situation, what are the factors that are affecting the woman and the man individually before we even look at the couple? So many people ask me a similar question, which is, if I'm not able to conceive and if I'm not able to keep a healthy pregnancy to term, is it because I'm incompatible with my partner? That's usually a really, kind of, it's a big question that people ask, and that is not true. That's not the reason. Some people, have genes that are very, very similar for various reasons. And so, from that perspective, yes, but again, there's a such small percentage of the population, right? And so from that perspective, incompatibility is not really, the more different the genes, the better. Right. So the more, quote unquote, the more incompatible, the better when it comes to fertility and the gene pool. Right. It's when you are the most similar that is actually a problematic situation. But there are two things to this. The man is equally as important as the woman in the couple overcoming infertility and recurrent miscarriage, and therefore, whatever it is that's going to affect their health, whether it's mental, emotional, psychological, whatever it is going to affect their body, and it's going to affect, in some way, that dynamic of conception. In this day and age, it's very common for doctors and just kind of medicine in general to take the fertility conversation and boil it down to very simple terms of the egg and the sperm, and really all we have to do is get them together and we end up with an embryo. But the truth is, if that was the case, that all we need to do is to get an egg and a sperm together, we would not have a situation where fertility treatment still per cycle delivers on average a 30% pregnancy rate, right? So it would have a situation where in every single instance, you get an egg and a sperm together and you end up with a baby. That's not what happens, which tells me that there is a multitude of other things, whether it's emotional, psychological, or otherwise, that's playing a role into the equation. And for some people, I mean, we know, if I was to ask anybody, even somebody who has never really, kind of has dived deep into the specific effects of stress on the body, if I was to ask them, do you believe that stress causes emotional discomfort? People would say,
yes.
What? Yes,
absolutely.
Now, do you believe that sustained emotional discomfort impacts your health?
Yes, I'm a
right.
Yes.
Yeah, right. Most people would answer that question in that way, and therefore, sustained emotional impact, would it be then reasonable to assume that if we have a very long-standing constant emotional distress, that we would start feeling symptoms of disease?
Right.
Very likely, right? I mean, there are numerous instances where we know that high stress levels causes stomach ulcers, right? And it's not
Headaches.
the only thing. Absolutely, headaches, you name it. So our body hasn't evolved very far away from where it was 10,000 years ago, when our number one focus was to run away from the saber-toothed tiger, right? In that kind of situation of high levels of stress, acute stress, the body really focuses all of its energy on the organs and systems most important for warding off immediate danger.
Got it.
So it will focus all of your nutrients, all of your blood flow, all of the things that you in your brain, so that you can really have acute focus into your muscles, into your lungs. It's like whatever's going to help you run, right? And it takes away all of the energy, blood supply, nutrients from the organs and systems that are not important for warding off immediate danger, right? And so basically, digestion, why would you want to digest the food when you're about to become food? Right. Reproductive function, forget it. Why would you want to have a baby when you're about to, become food again?
Be somebody's dinner.
Absolutely. And finally, immune function, the little bug inside you isn't going to kill you as quickly as the one running after you. So you better just focus on getting through whatever it is that you're getting through.
True.
And as humans, we are the only animals that can mediate that stress response purely by thought. The second that we think about something that is highly unpleasant, or that stresses us out, or that makes us feel vulnerable or off kilter, we have stress hormones that are going to flood the system. Okay. And even a paper cut, it's like a simple, silly thing, but it's like all of a sudden it creates that acute stress response. And the effect of those hormones in the body can last for hours, right? Adrenaline and noradrenaline are very powerful hormones that are specific for that purpose of, really all the things that I've already discussed. That's what's going to happen. That's what's going to trigger cortisol, adrenaline, noradrenaline. So what happens in those situations is that as we continue to have these stress responses, like even if we're just unhappy about a particular situation in our lives and we keep thinking about that, we're going to continue perpetuating those that cocktail of chemicals within the system. Okay. And so that is going to become very much a way in which the system operates, and it's going to continually put focus in areas that essentially you don't need to focus on all the time, and take focus away from areas that you want to focus on, right? So that's the impact that stress can have on fertility. But the other aspect to this is that when it comes to the precursor hormones that make up both sex hormones and also stress hormones, it's the same precursor.
Okay.
So if you're utilizing all of those precursors to make stress hormones, you are not going to be using it for reproductive function.
That makes complete sense. Yes.
Yeah. And so basically that's the effect. I always say to my patients, there's no point in stressing about stress. So, that's not great, because a lot of times people think, oh my God, I'm not getting pregnant because I'm stressed. Now, because I'm stressed, I'm going to be more stressed about it. It's a kind of a snowball effect.
Right.
So the key is to recognize and to learn and to be aware of the fact that, okay, yes, stress is going to play a role. And yes, it is something that we do need to address, but how do we address it? We don't address by focusing on it.
Right. Exactly.
We don't address by continuously talking about the things that we don't want and that we don't like and why it's a problem, and facing that trauma head on, right? Because even those pieces like stress on a day-to-day, they're little micro traumas, right? So that essentially we endure. And for people that have had severe trauma in their life, it's reasonable to assume that unless that is dealt with, or what is often done by many survivors of kind of acute trauma and past trauma, it's kind of like a suppression that goes on, right? It's like, let's just put it aside somewhere where we don't really see it, where we can't really notice it or notice its impact, because that way we're safe to continue on with our lives and our day-to-day in the best possible way. And so those thoughts and those emotions and those drivers become subconscious, right? They start to drive our behavior, the thoughts that we think, and essentially our beliefs and our attitudes and our mindset, and therefore the behaviors that we engage in, and of course, which leads to a particular result, right? So understanding that is critical, because if we understand that if we want to change a result, the first place for us to start is actually in the repeated thoughts that we think. Right? Because those repeated thoughts, they're going to lead to the belief, which is going to lead to the attitude and the mindset, which is going to lead to the behavior, which is going to lead to the result. Correct. So this cascading effect is changeable. And you don't have to focus on necessarily the thing that you were traumatized by. Now, some people find relief in doing that. Right. And one of the absolute, my favorite tools of all time is actually writing therapy. But it's writing therapy in a very specific way. Dr. James Baker, who's a researcher at Texas University, he basically has researched, he's got a fantastic book called Writing It Down. I'll give you the name, but basically, in fact, I think that it's something that's pretty easy for me to find for you. But expressive writing is the type of research that he does. And he's got a book that I love. I actually interviewed Dr. James Baker for one of my podcasts and on Talk Sex with Gabriela Rosa. And his research, and what I find really beneficial in terms of what it is that he researches and how he does it, is that he started researching writing for therapy as a therapy with people who were experiencing sexual trauma. And that's why I invited him to talk, to come to the podcast, because some of my patients have experienced sexual trauma, and he really has, kind of figured out this really elegant way of helping people overcome all sorts of different types of traumas and challenges through a very simple process of writing. Now, what he recommends, and I'll just go through it because it's very simple, people can implement it at any time. What he recommends is 4 sessions of writing of 10 minutes each, right? And basically, they can be 4 days in a row, 4 consecutive days, or they can be 10 minutes spaced by a 5-minute break. So you can do it for a whole 40 minutes if you want to. But basically, it's literally you're just writing on the thing that's bothering you. It is free writing. You're not, the whole point is that you start and you don't stop your pen on paper, right? So you're literally just going to write whatever it is that comes to mind. I don't even know what else to write. You keep writing, right? And you keep writing those words. I don't know what else to write. I don't know what else this, means for me. And, but I feel really angry because this happened, and whatever it is that comes to mind, you just write. And I've done this exercise many, many times in my life since finding it a couple of decades ago. Yeah. And I have to say, every time I start with something, the thing that I uncover on my fourth writing session is completely unrelated to the thing that I started writing on. And every single time, and I don't know if you've had this experience, Lisa, but every single time I was like in awe of what I discovered. That was kind of lurking underneath, really kind of making me feel uneasy, that all of a sudden, when I was able to just see it on paper and make sense of it, it just lost its grip on me completely.
I was going to say we lost its power. Sometimes
when
we pull that stuff out of us, whether we speak it or we write it, and I'm in 100% agreement. Writing is huge. It loses its power.
Absolutely. And I think that that's one of the things that, for people to understand that a lot of these, and actually this is the book that I was wanting to tell you about, it's Opening Up by Writing It Down. It's a great book, Dr. James Baker. And, and look, you don't need to read the book. I mean, basically what I've told you is exactly what you need to do.
Right.
But what's great about the book is that he goes through the research, he goes through and explains a lot of the information that, the whys. And
that's what I like. I like the whys.
Absolutely. And he actually, because, he was very concise in his interview in Talk Sex podcast with Gabriela Rosa. People can just search that as well, and they will be able to find that interview. But it's that ability to implement something that's going to be really useful. I'm such a fan of strategies that are going to be practical first and foremost, and effective. Right. Yeah. I think that if something is going to be very convoluted, it can be very difficult to implement. Then
overwhelming.
People don't do it. And it's overwhelming. People don't do it. And, you name it. Right. So the key aspect, that's one thing that I absolutely highly recommend, that writing therapy makes a huge difference for a lot of people as well. I mean, look, over the years, and these are, I'm just kind of relaying things that I have seen work very well for my patients, right?
That's exactly what this is about. I love it. I love it.
Yeah, exactly. In terms of the things that are going to be helpful and practical, but also very effective. One thing that I know, and this happens often, and this happens often on the fertility journey, particularly when couples, you can imagine this, right? When you've been trying for a few months and you haven't conceived, and it's kind of early days, you may not see a pregnancy test, but you're not devastated about it, right? Yeah. When you've seen the 30th negative pregnancy test, you probably start to become a little bit more traumatized by seeing yet another, right? And the feelings and emotions that so many women experience in that 2-week wait, like after ovulation and the attempt to conceive, and then 2 weeks before they know whether they're pregnant or they have a period, can be in itself immensely traumatizing and re-traumatizing. Because every single day, and every day for 2 weeks, every month, and that continues and continues. And of course, the impact of that is not going to be unfelt in the relationship. Yeah. Because if your partner is up in arms about the fact that what is going to happen, yes, of course she's going to feel vulnerable. Of course she's going to feel afraid, all sorts of emotions. And sometimes, as a partner, it can be really difficult to see your partner experiencing and going through those challenges, right? And going through those emotions on a kind of persistent basis. And because of the way, again, in which the healthcare system is oriented, men are almost like the sperm donor of their own fertility journeys, right? Because it's all about the woman. Let's get all the testing done. Let's get all of the things done. And you just come on this day and produce a sample. Right. Is there anything else I need to do, doctor? No, you're done. Yes, you are right. And so men feel really, kind of alienated from the situation. They feel like, okay, well, is there something I can do? Is there a way that I can help? And they feel very, it's a big challenge. And so what ends up happening in many situations is that they withdraw. The woman becomes more needy, right, of attention and support. And there's usually a lot of fighting that goes on for many couples.
And throw in there some hormones that are going, if they've been through IVF or anything like that, where their hormones are out of whack. Oh, absolutely. And, I mean, look, the situation of women being infertile, there was a study that showed that women reported, 20% of women reported that they would rather be disabled than infertile. Wow. So you can imagine, right? It's not an easy thing to go through, especially because we see the majority of people having drunken one-night stands and getting pregnant. Right. So why is it not happening for me? Right. What is it that I need to do? So all of those questions come to the fore, and then all of a sudden a woman becomes very internal in terms of like, we have this tendency to retreat within ourselves and go, well, hang on a second, there's something wrong with me. And all of a sudden we start to pick fault,
right, with ourselves, because we think that, okay, well, this is a normal, natural function that my body should be able to perform, and it's not, therefore it's broken, therefore I'm broken, therefore, like these escalating thoughts.
And if there's trauma, childhood trauma in there, that just confirms so much that's in her head.
That's right. Absolutely.
Yeah.
Which, if we can be reasonable about it in a moment of, rational reason, it's easy to see that, no, you're not a bad person. You're not a broken person. These things, there's nothing wrong with you. But tell that to a woman who is in the throes and in the midst of all of those emotions.
Right? Exactly.
It's a very, very difficult thing for her to accept and acknowledge about herself, right? And so there are lots of extra challenges that go on, in that situation. So the important thing here, and this is one of the things that, I have discussions with my patients all the time, is to catch those feelings and emotions way before they come about.
Correct.
Way before they take hold.
Correct.
Because the second that they've taken hold, it's like a slippery slope, right?
It's hard to reel yourself back in once you've gone down that slide.
Absolutely. And the thing about it is that, from a scientific perspective, we know in terms of habit formation, we know that that's never going to happen. Right? We're not going to reel ourselves back. We're literally going to fulfill the habits that we have developed in the way that we respond to a certain situation.
Right.
So the only key here is, like, whenever you have the trigger, whatever the trigger might be, that part in the middle that is between the trigger and the outcome, which is the response piece, that's the piece that we need to go, okay. And we have to do this in advance, because if we don't do this in advance, when we are in the middle of those storm of emotions, it's not going to happen.
No.
So it's almost like, and again, that's where writing things down comes really handy. So it's like, okay, when I'm in the 2-week wait, what are 20 different responses that and literally writing down 20 different things that I can do if I feel myself becoming overwhelmed, right? If I feel myself, and mind you, whether this is on the fertility journey or whether this is just, like at
life,
work,
right?
Life in general, right? If people can apply this to anything.
Yes, I do this. So, I know exactly where you're going.
So it's literally just about going, okay, so what are the 20 different ways that I can respond differently here? And, and basically, what are some ways that I can resource myself? Because otherwise we are left with the same usual response that we would get every single time.
Yep.
And that known response is going to give us a very known outcome.
Correct.
Right? And so that second way of being able to address these issues is going to be really important, particularly in advance of something that we know is likely to repeat itself.
Right.
Because then you have a different tool to be able to address it. Right. And in the same way that, I often say to my patients, I say, listen, what is something that you could think about or that you could do that is completely unrelated to what it is that you would normally do, that when you start to see yourself going down this path, that you can just implement right there and then.
Right.
Like for me, for example, one of the things that I did, and this is a bit over a year ago now, as I was waiting to hear whether I had been accepted to my doctorate or not at Harvard, I was like so stressed, right? Because I was finishing my master's. I really wanted to get into this program. And I was like, okay, well, what if I don't get in? What's going to happen or whatever, right? And so, I started to become hyper-focused on, okay, what's going to happen? And I'm waiting for this letter. What's the date today? Like all of these things. And I thought, you know what? Like, this is causing anxiety unnecessarily. Like, I'm either going to get in or I'm not, and I'm going to live no matter what.
Either way.
Like, either way, you're still going to live, right? So, Gabriela, what are you going to do differently? And so I did something that was totally and completely out of the ordinary for me. Which, and this is something that I highly recommend people do and do more of, because it's in those pattern interrupt moments
Mm-hmm.
that you are able to see things differently, and you might even find something that you really love that you didn't even know you did.
Yes.
So, as I'm kind of in the throes of this kind of anxious moment, and I'm not even an anxious person typically, I was like, okay, that's it, enough. I've got to do something that is completely different that I would never do. First thing that came to my mind, I went, that's it, I'm doing that. Watercolor painting classes. It was like, I literally asked myself one question: what is one thing that you could do that you've never done before? And like, I don't know where that answer came from, but it came from, and I don't paint, like before this moment, I don't paint, I don't draw, I don't even own like coloring pencils or, or anything at all to do with art. So I was like, you know what? I got to lose. Let's go. So literally, I went online and searched, watercolor painting class this week, and lo and behold, I found some online classes. I found a class that was happening on Saturday. This was Wednesday, right? All right, you know what? That's it. I'm booking in. I booked myself and my mum. We went on Saturday to this class. It was literally a one-off class. And we went to this class. At the end of the class, I said, yep, this is great. Let's continue. And I booked for another 10-week class with this
nice
teacher. And I started. And, like now I've been painting for a year and a half. I'm taking classes at the Museum of Fine Arts in Boston,
Wow.
Like, honestly, it was something that was so unexpected and so just completely different to what I would ordinarily do, which was why it was so enticing, because it was kind of like, you know what, I don't know any of this, and becoming a learner again, becoming, something that is fun, that's enjoyable,
challenging.
that is challenging. And, the criteria that I used for the thing that popped into my mind was I wanted to do something fun.
Yeah.
Right. And the thing about it is that, like, I never have seen myself as being artistic. So I would never, like, if I was consciously picking something, I would have never picked painting, because I'm like, I'm not a painter, like, and I'm too old to paint,
Well, clearly you're not. We got to put artist down on your little resume here, on your bio. She's now an artist.
I don't know that I would go that far, but what has happened, and and again, the way that I actually went about this, and the reason that I mention it is because I think that if people can see for themselves where this applies, and figure out, okay, how could I make, because the more you think about it, the more you don't do yourself a service, right? And so for me, it was like, okay, it has to be fun. I love colors. What else is there?
Right.
It's something and creating something is also a wonderful thing. And the reason, again, also that I mentioned about painting is because so many people utilize painting as a form of therapy, right? For addressing, for bringing to the fore some of those traumatic, experiences and events in a way that is not censored by their cognitive function.
Right. I mean, I was just thinking when you were telling me that, like, that's a whole conversation we could have, just you doing that and what it did for you. Right. I mean, that could be a whole nother podcast episode, because I mean, it's huge. The confidence, because to me, it would be a stress reliever. Like, creating something would be, to me, a stress reliever. Right?
Yeah, absolutely. Absolutely. And the thing about it too is that, I think that what's beautiful for people to take away from this conversation is that the key aspect here is that you need to let yourself off the hook in any new thing that you are trying or that you're wanting to do, because what happens is that, and I'm usually, as you can imagine, right, getting into Harvard for the third time, it's like, you've got to have some streak of like A-type personality or whatever it is.
Yes.
But, really, I kind of try not to be too kind of, prescriptive in the way that I live my life, because I think that, there's such beauty in the texture that you can kind of add into your life. So I don't
discovery is awesome, right?
Absolutely, 100%. And so, but at the same time, there is that part, and I think everybody has that part, that I just have to do this right, I just have to, whatever it is that we're doing, it's like, no, hang on a second, I can't start yet, or I can't do this, or I can't do that, because I have to do this thing right. And that is the biggest disservice we do to ourselves, because rather than jumping in, taking our mind away from what it is that we would normally and ordinarily be thinking about, or that would be driving us to, continue to perpetuate those micro traumas. It's a way to just relieve ourselves from the need to perform, the need to be any particular thing. And whatever it is that you do, whether it's, this time, actually, it's funny because this is not the first time in my life that I decided to use creativity as a way to deal with some challenging situations. Like this was obviously me getting to Harvard, but when I was actually trying to get pregnant with my second child and experience secondary infertility, I was really stressed about the fact that I could not control, I was diagnosed with polycystic ovarian syndrome at the age of 18. And I couldn't control the fact that my cycles were just, after having had my first child, was 2 years down the track, and I still hadn't gotten my period. Right. And so, and I was ready to have another baby. I was like, okay, I'm ready now, let's go. And it was another 17 months after I was ready that I was actually able to even start trying. But what that did, it was a situation where I was like, okay, first of all, this is what my patients go through. Right. So it was a really kind of a moment of deep compassion for the people I serve, but also for really truly understanding what that feels like. And it's not pleasant, but also kind of realizing that being anywhere but in the present moment, whenever you are dealing with a stressful situation, a traumatic situation, or whatever it is that we're dealing with, doesn't serve. Right. So the key is to find tools and strategies and activities that are going to keep us very firmly focused in the present moment, whether that may be meditation, whether that may be, and by meditation, I just say, like, listen to the air conditioning in the room for 20 minutes, like that's really all that it has to be. It's something that will empty your mind. It doesn't have to be any kind of performance. You don't have to experience any kind of enlightenment.
No, just calm this down for a minute,
Exactly. It's just like literally put on a fan and listen to that, or listen to the air conditioning in a room. That will do it. But, for me, the other thing, and I've realized this about myself, is that I really love creativity. Like I said, I love colors, and I love seeing things being created and creating things. And so I actually at that point started doing quilting classes, right? And it was really funny because I was like, at the time, I was 30, I think I was 34 or 35. And I was doing quilting classes with 80-year-old ladies,
and learning a lot, I'm sure.
And oh my God, they became my best friends. They were the coolest people to hang out with. And this thing of like just being in the moment, having conversations with women who were so wise and just so alive at the same time. It was just like this most amazing thing, and who had incredible skills. I would look at some of their work and I'm like, oh my God, one day I might be as good as you.
30 years from now.
Exactly, precisely. And but it's about those pieces. I think that for a lot of people, whether we're dealing with trauma, recurring or past, or whether we're dealing with stress, or whether we're dealing with challenging situations in life, it's figuring out what are the pieces that we can tap into that, one, bring us into the present moment, two, that gets our mindset focused on what we love, what we enjoy, what we're creating, essentially emotions and feelings that are positive, as opposed to being stuck in emotions and feelings that don't serve us. Right. That's the key aspect. That's one thing that, when we are talking about that transmutation of emotion, of, whatever it is that emotion might be, if it's not what we want it to be, it's about picking the thread from where you can see it, right? And figuring out, okay, what is one thing that if I was to do that one thing, it would just make me feel some sense of relief.
Take that pressure off.
Exactly.
Little pressure.
Exactly. And that sense of relief, what's the next step that I can take that will give me an even greater sense of relief, and so on, and continuing to peel those layers, because eventually you will find something that when you're doing it, and if you already have that thing, that when you're doing it, it just makes you feel light and happy and full of joy. Well, then, like, spend no time thinking about the thing that, you know, is bothering you, and go and focus more on the things that are actually going to be supportive to you. And, you know, the majority of people who experience trauma, you know, in my clinic, and I'm not speaking for, you know, people who literally need to be hospitalized or institutionalized or, you know, any of those types of situations, the very, very severe cases of trauma. You know, every single person lives with a component of trauma in their life.
Sure. Yes.
Like, that is just, you know, if you're human,
it's
you
life.
will have some trauma, right?
It's life.
Exactly.
Yeah, it's life. Right.
Exactly. So, you know, so from that perspective, it's about figuring out, okay, how is it that I best deal with that situation? What is going to be the best thing for me in dealing with that? Because every person is also very different, right? Some people, you see, this is where it's not working. If you internalize it and you then engage in destructive behavior to deal and manage, then that's not going to be helpful and supportive, right? Then you need to figure out a way of seeing someone professionally qualified to be able to support you with those types of situations. But if you have, you know, a level of trauma where writing it, painting it, talking it, whatever it is, you know, thinking about different thoughts, exercising makes you feel relief, then do more of that and think more about the things that you want to experience and that you want to have, as opposed to the things that just make you sad or make you feel bad, or, you know, don't actually give you the lift, the light that you would like to feel and that you like to experience.
I mean, I give this example a lot, and I use this example a lot in my life. You know, when I feel, you know, self-awareness is the key, right, to healing, growing. And if I catch myself feeling down, what am I thinking about? And whatever it is, I'm like, I recognize, oh, that's not a very positive thought. And what I will do is switch it. What is it? How do I want this outcome to actually look? I don't want it to look like this. I know this because I've been meditating on this for a while and I feel really bad and I want to feel good. I switch it and I start focusing on what I want it to actually look like. And I'll give you a great example. So last year, my husband had a really serious infection in his arm and he had to go to the hospital, and it was scary. And my mind, because I am a caretaker and I have taken care of people, went to, of course, the worst situation, right? And I can tell you, I couldn't sit still. I was literally at times running around the house. I had so much anxiety, and I caught myself and I had to stop it. And I had to start thinking, no, what do I want this outcome to look like? And you know what? That was a game changer for me. Yeah. And you know what? It came out, how it came out is exactly the way I had wanted it to come out. I'm not saying that I did that. I'm just saying, because where I was going in that moment when my anxiety was, I felt like a trapped animal. I didn't know how to get myself out of it. It's this horrible, vicious cycle. And you're like, how do I get off this hamster wheel? And how I got off is I went, wait a minute, I can't be thinking about this. What do I want it to look like? I want it to look like this. And I focused as much as I could and meditated on it. And that's what got me through it, because that was tough.
Yeah, absolutely. And, you know, for some people that will work brilliantly. And then for other people, it's actually better just to think of something completely different.
Correct. Well, yes.
You know, because it's like, it's one of those things where sometimes when people are so entrenched, and especially if a situation has been going on for a very long time. Right. But it's a wonderful way, because what happens is that we are the only animals who can deliberately choose where we direct our attention and our focus. True. Right. In the wilderness, it's not quite like that. You've got to kind of figure out what's going to eat you, right? And what's coming for you kind of situation. But we have the privilege of being able to direct our focus and our thoughts wherever it is that we would like. And what you said is so vital, the key aspect is to really catch that process early. Right? It's when, if we again talk about the slippery slide, right? It's literally as you're going up the steps of the slippery slide, before you get to the top is where you need to start thinking, hang on a second. Right. Do I really want to get to the top? Because if we wait until we are at the top, sitting down, ready to go, it's going to be harder to get up and go back down the steps.
Because you're already in that forward momentum, right?
In that habit loop.
Right. The habit
loop. Absolutely. You are already in that, like, you know, you go up, you sit, you go down. Like you're already in that habit loop. So the key is to go, okay, hang on a second. Let me question, do I want to go up these steps? That's where you start in the moment, exactly, is the critical piece. And every single time that we start going back up the steps is the question to ask, okay, what else can I do instead right now? Right, so that we can actually go and do something else immediately, as opposed to waiting until we get up to the top. And also realize that there will be times that we're just going to go for it. Right. And to have the self-compassion to go, that's okay. I'm going to, again, be mindful next time before I go up the steps and do my best. Right. To prevent myself from going up the steps. And it's a process of, you know, new habit formation. Retraining. So that, you know, like a wonderful piece of understanding that we get from psychoneuroimmunology research is that you come with pathways, with neural pathways. You cannot erase neural pathways. You can build new ones and strengthen new ones. Right. And so there's no point in thinking about, oh, I want to erase this neural pathway. No, think about what do you want instead. Right. And focus there. Focus on what it is. And that's where what you've said, meditating and focusing on what you wanted instead is important. And equally important when we're really looking at, okay, what new habits do I want to form? Because the old habit of being myself is not serving me. Right. Then we go, okay, given that this is the new habit that I want to form, no matter how many times you might fail, as you are forming it, just keep strengthening it, keep focusing on it, keep redirecting attention to it. Right. Because in doing that, we strengthen a whole new neural pathway that removes, it's almost like the best analogy that I can give you here is this. Think about an enormous field, and you have a gate at the entrance of this field. And you have to go from the gate of the entry until, say, the far right corner of this field every single day. But the grass is overgrown. And so you just want to find the fastest possible path to the next gate that you want to get to. So you start on the overgrown grass and you start stepping. And every day you step the same path. What happens after a while? After a while, that path becomes beaten, right? Correct. It basically, and very clear, will flatten. It will become very clear. You no longer need to kind of think about, well, where did I step yesterday? Because you will know that you will be able to see it. Now, let's say that in all farmers' wisdom, they decided to move that gate from that end of the field on the far right corner to the far left corner. All of a sudden, we have the same issue. We have a path that is overgrown with grass now on the opposite side of the field. But we have no choice because that's where the gate has gone. So we have to beat that path up again until that next gate. Give it just a few weeks and all of a sudden you will no longer see the path that you used to go up to the right-hand side of the far field. Right. You will start to see the path on the left side because that's the path that you're reinforcing. Right. And the same happens with our neural pathways. The more that we do an action, an activity, a pattern of thinking, whatever it is, the more we reinforce it and the easier it becomes. Even though in the beginning, you know, like everybody has had the experience when they move house, inevitably at one point, very recently after the move, they will be finding themselves driving to the old house. Yes. I go, no, but hang on a second, I don't live there anymore. That's because we've become so conditioned to a way of getting home. right? And all of a sudden we find ourselves, without thinking, we put ourselves on autopilot and we find ourselves where it is that we were before. And so the key here is to go, okay, let's reprogram, right? Let's build a new neural pathway and find new resources to strengthen it. And that is something that serves literally every human on every subject that they might feel is important to them.
Right, right. I'm really glad that you mentioned, though, about giving yourself grace, that you're going to mess up. It's okay. It's okay.
Absolutely.
Catching yourself and getting back on it. And with time, it does get easier. It does get easier and it becomes automatic. But at first it is a little hard and you're going to make mistakes, but that's okay. You just catch yourself and you keep moving forward. I mean, that's what it's all about, right?
100%, 100%. And the other thing as well, I think also that's really important for couples to keep in mind is that the process of dealing with challenges on the fertility journey, but in life, right, in a relationship as well, is such that it's a couple experience, but it's really also a very individual experience.
True.
Right?
Their experiences are both different, right?
Absolutely. Each person has a different experience and each person needs to deal with that situation in a different way. And what's most important to remember is that you are not your partner's therapist, right?
Oh, yeah.
And you are not the one that needs to point out that they should do this or they should do that.
Right.
Because that will never help. If somebody doesn't feel that they want to do something, the only thing you can do is lead by the best possible example you can in your life and your experience, and let your example be the kind of the broadcasting of whatever it is that you may or may not like to say, because the role of a partner to a great extent in these types of situations is literally just to be there and to let the person know that, you know what, I'm here for you. There's nothing I can do to deal with this situation for you. It's something that you do need to deal with for yourself. And, I'm here. But also be encouraging for that person to be able to seek extra help and extra support if they really need it, rather than, trying to tell them that they should do things in a certain way, because that's never going to be helpful.
No. And, that's wisdom in a relationship too, right? Not just with infertility, but you're right. I mean, there's so many emotions in that. And as you're right, each one, it's a journey for each of them and then them together.
Yeah, absolutely.
Wow.
So critical to understand that piece, because, it's so easy for couples to feel like the situation is difficult and they feel their own difficulty in the situation. But sometimes it's very easy to overlook how your partner might be feeling in the situation. Right. Or even feel and think that they're blaming you for what's going on. In the vast majority of cases, that's actually not what's happening. Right. And that reassurance between partners is also really important, and that's one of the things that I think is so vital for couples to be able to have that open communication and conversation about, what it is that how they both would like to feel supported in the relationship and through difficult challenges. Because people are very different. Some people they need one thing, another person needs another thing,
and neither are wrong.
So, and neither are wrong. And the key is actually asking the question, how do you need me to show up for you? Because otherwise, like we will do for our partner what we think they want based on what it is that we want.
Correct, because we don't know.
Exactly. We don't know any different. And so it might be that for them, what they want is extremely different to what it is that we want, and so if we go and we do that thing for them that we think is what they would like, most likely we're going to hit the mark. We're going to miss the mark, right? And the only way to really hit the mark is actually to ask the question and to know from their mouth, from their words, as opposed to try and assume that we know, right? And also, one really key thing, one really critical piece that I think is so important for both men and women to understand is that what works for me today might not work for me tomorrow.
True.
Right?
True.
What works for me in this cycle, in finding out that I'm not pregnant, might not work for me next cycle.
That's
so
true.
Asking the question of, how do you need me to show up for you? What is it that you need to feel right now, or that you need to kind of, to feel like yourself, or whatever it is that how you want to word the question. But, what is it that you need right now is a really important way of coming about it, because, it's important to remember that what worked today might not work tomorrow, or the next day, or next month, or, a year from now.
It's so true. That is such a good point. That is so true. Our emotions can be all over the place, right?
Yeah. And it changes, it changes with different circumstances. It changes with different, triggers.
Sure.
It changes with, how triggers are a really big part, of the changes that we experience. And it also changes depending on what happened last month.
Right.
A woman will respond very differently. Let's say, for example, if she's never been pregnant before, and she has never seen a positive pregnancy test before, and then all of a sudden she might be pregnant and sadly miscarry, she might respond very, very differently to a future pregnancy test, or even to a future conception attempt, because of the fear of what if that happens again. So there's a whole process of understanding that is required from both their parts, to be able to see, okay, well, what is it that I need? And then to be able to relay that to a partner. Right. That's a critical piece to understand, because also, if you don't know what it is that you need, and that's why I highly encourage people to do things that will enable them to look inside themselves, because if you don't know what it is that you need, how are you ever going to relay it to your partner in a way that they can understand and can action it? Right.
And how frustrating that is when you don't know what you need.
Exactly.
Right? It's so frustrating for yourself. And so that writing that you were talking about is huge. That helps bring that stuff up and brings it out. It's surprising.
And sometimes, Lisa, sometimes it's like, what I need is a bubble bath right now. Like, it might be that, what I need is a cup of tea. Like, you might be so in the middle of emotions, right? You can't articulate, or you can't go through, quote unquote, the work that it takes to uncover and discover. Right. So really, it's like sometimes we really need to get ourselves off the hook, right? And rather than think that we have to perform and that we have to do all of these things, it's like, you know what? Sit back, take a deep breath, and ask yourself the question, what do I feel like I need right now? And if that is the only thing you have the energy emotionally to deal with and to answer the question for, then just do that. And just say, look, that's right now, I just need a glass of water, and I just need a little bit of peace, or I need a hug, or whatever. Right. So
right there reduces stress right there. Just answering that question or working through that. Because what I'm hearing from this, a lot of this is so much self-care, right? That is true for everybody, but especially here. Yeah. Because the whole infertility thing is so complicated. I know that to be true. What the little bit that I know of it, it's so complicated for humans. And so we really need to do the self-care.
Yeah, to be gentle with myself is very, very important. And to know that, ultimately things are going to work out. Like, this is a chapter, and it's one that passes, and and there is support, and there are people who are able to to shine a light on the path. And so I think that sometimes just having that's where I talk about pulling the little threads, like literally just like the thread that you can see. If that's a cup of tea, just go there. Whatever's going to provide just that little bit of relief in this moment, and bring a little bit of ease is enough. Right. Until you can get to a point where you can take a deep breath and go, okay, I feel resourced now. I feel emotionally strong right now. I feel like I can actually put some things down on paper,
Mm-hmm.
or I feel like I can actually do something else that's going to be more substantial. But it's being gentle. I think that
Yeah.
that's
And it's empowering. It's empowering when you start doing that. When you start taking
absolutely.
care of yourself, when you start doing those little things, and those little things add up. Because I know for me, I can easily get overwhelmed, and I can look at the big picture, and I can and then what I would do in the past is just freeze, right? Or just, spin myself out. And I've learned, like, when I catch myself feeling overwhelmed, that's exactly what I do. I stop and I take a minute, and what can I do right now to give myself that minute, and take this big thing and take it to something that I can manage.
Absolutely. So
It's empowering.
critical.
Yes. Well, thank you so much. This has been really enlightening. Why don't you share with everybody how they can get in touch with you? I'm sure, it'd be great for people to be able to reach out to you for the infertility, among other things.
Sure.
Yeah.
Absolutely. So people can Google me. So Gabriela, Gabriela Rosa, or go to my website, which is fertilitybreakthrough.com. That's fertilitybreakthrough.com.
Great. And we'll have all that listed too, so everybody can get in touch with you. And thank you so much. This has been enlightening for sure.
No, it's a wonderful pleasure to be here. And I hope that, it helps at least one person to figure out, how they can navigate what is sometimes such a challenging journey.